Eastern Idaho Regional Medical Center was recently re-verified as a Level 2 trauma center. KPVI News That Works for You journalist Zane Hopen spoke with officials who hope more people learn about the healthcare resources they provide locally.
Trauma is the leading cause of death for people until they reach age 44. Eastern Idaho Regional Medical Center recently became re-verified as a Level 2 trauma center, one of 3 in the state of Idaho.
We want to make sure that our staff and our physicians understand what the standard of care is across the nation and that we meet that so that we optimize that outcome for them.
And for EIRMC, summertime is peak trauma season. Most of the hospital's trauma-caused injuries come from outdoor activities, with top 5 most common being falling, motor vehicle accidents, ATV riding, motorcycling, and horseback riding. But one obstacle EIRMC faces is making sure people know these resources are available.
Sometimes it's just a lack of education and they don't know what we provide exactly. I've had phone calls from Twin Falls saying, hey, I didn't know you guys had a PICU. Do you really have a PICU? And I'm like, absolutely, we have a PICU, and we've had a PICU for a couple of years.
The hospital says they're doing outreach to make sure their services are more known and to save people from having to travel out of state for services they may not have to. One way they've helped people reduce travel for care is by adding their burn center, which has already saved many patients time and money.
Having the burn center added in has affected our exposure, so we're getting patients from farther out in Montana and Wyoming, places that wouldn't typically have come here because they would just overfly us.
Providing help to the locals as well as the region.
The verification process is not required, but EIRMC hopes it will help staff members keep the standard in mind.